Good evening, Beijing. Good morning, Ann Arbor. My name is Joe Kolars, and I'd like to welcome you to our webinar, jointly sponsored by our Center for Global Health Equity and our joint institute with Peking University Health Science Center on pursuing global health equity, perspectives from China in the US. The purpose of this webinar is to really understand mutual interests in global health, particularly around the concept of equity, so as to advance collaboration and scholarly opportunities before that will exist between our two institutions. Next slide, please. A special welcome to Professor Chih and so many colleagues from Beijing. I know it's a little bit late for you there, and it's a little bit early for us here, but we do have 130 people who have chosen to tune in. So we're really really excited about the opportunity to share and again, have what I think is going to be the first of many discussions on the kinds of things that we can do together. Next slide. After a very brief introduction from me, I'm going to be turning things over to Professor Chih to share some perspectives from Peking University and to introduce his panel members, after which I will introduce some of my colleagues here at the University of Michigan, and we'll be having a panel discussion. And please put any questions that may arise into your question box. And again, we plan on advancing these conversations over time. Next slide. For those of you in China who have not had an opportunity to visit us here at the University of Michigan, please plan for it. We're a relatively small town in the Midwest, 110,000. People in China don't call us a town, they call us a bus stop. You know, everything is so much smaller here than in China. But we're a university town, and specifically we're a public university. Next slide. In fact, we're the top public research university in the US with many graduate programs, 1.5 billion in annual research expenditures, a lot of firsts. But to be honest with you, many of us know that part of our strengths is our long history of collaboration with China that goes back to the 1800s. So it's really made us better as an institution, and we will continue with that legacy. Next slide. Our university structure, you know, we're a state school. We're a private. We're not a private school like a Harvard or a Yale or a Stanford. And we have 19 different schools and colleges, and a big part of our campus is Michigan Medicine. Unlike Peking University, Michigan Medicine, our hospitals and our clinics and our health campuses all right together with our main campus. I know in Beijing there you have Peking University Health Science Center that's separate from the central campus. But we have a number of schools and colleges like Peking University. We also have institutes and centers. And I'd like to tell you about one of these that has really been a story of success with Peking University, and that is our Joint Institute for Clinical and Translational Research. Next slide. So this got started actually back in 2010. And where we do a lot of collaborative projects with colleagues there at Peking University. We have our own internal funding structure. I think we're up to about 160 projects. We've written well over 140 papers together. If you look at the extramural funding we've been able to generate just on the United States alone, it's 30 million. I know that's bigger in China. But it's just been a great win-win co-design of projects and bringing us together that has been a real success story for us. Next slide. We've come together around about programmatic themes, but to be honest with you, probably our real success in collaboration is shown in these yellow boxes where we have a joint core for biorepository and biomedical informatics, institutional review board and human protection and collaboration. So this has really been the secret that keeps us coming together. And until COVID, we were gathering every year, alternatively in Beijing or Ann Arbor, for really what is a growing momentum. Next slide. Another big center that was just formed 2 years ago is our Center for Global Health Equity, which I have the privilege of directing with people that you'll hear from later, John Ayanian, and a really great team. And really the focus of this center, first of all, this is across the university, really drawing on strengths from our faculty. A focus on impact in low income and some middle income countries to develop new scholarly and inclusive ways of measuring impact. Next slide. So this is made up of faculty. You know, again, we have over 19 schools and units. But when we actually look at our center membership, who comes together to collaborate, you can see representation from so many different schools. And of course, schools like public health, you know, the medical school, nursing has always been a big part of global health conversations. Next slide. Our themes, which we hope to connect with Peking University, is strengthening systems to support health and health equity, addressing and informing policy on the social determinants of health, developing technical solutions for health equity, and then empowering women as effectors of health. Next click, please. We have a lot of core values that are really important to us. It's very important for us that we're not just exporting the US way of thinking about things. We first need to understand and come to the table with some cultural humility and set up win-win such situations. We have a lens by which we assess opportunities. All of this is available on our website, but it's something we really hope to expand and build with Peking University. Next slide. We're having some major signature programs that we're starting to develop. One that has taken shape is around global vaccine equity. I think the COVID pandemic has really shown the inequity in a lot of our systems between haves and have-nots, and when it comes to accessing vaccines. Next slide. And finally, I'd like to end up by noting that the University of Michigan is very much, we've had a leadership role with the Consortium of Universities for Global Health. This is a set of institutions that started off in North America, but really extends around the world. And I'm so glad always to see the engagement in this group from China. And I'm actually the rising chair of the board of this group. In just 2 months, I'll be running it. So I also like to have an eye towards that. How can we leverage this to do good things together? So with that, I would like to now turn it over to my co-moderator. And this is Professor Chih. He's professor and lead the Department of Laboratory Science and Technology and the director of the Vaccine Research Center in the School of Public Health at Peking University. He's the interim chair for global health, and we're so glad to have you here, Professor Chih, and for you to have gathered such a panel. Professor Chih, over to you.
Thanks, Joe. Good morning, good evening, our colleagues, and this is a very good opportunity to improve the better understanding and the sharing, and to pursue their collaboration in the future. I think that, as Joe just mentioned, Peking University have very good, their research basis, based, their education and a lot of care issues. And I totally agree with the professor I just mentioned, and we were really want that this is a opportunity, we continue to sharing and discuss about the health equity issues. And there's particularly for some, the vaccine equity issues, the women equity issues, a lot of the issues. And so my colleagues and I were joining the discussion after the presentation. And so I would like to give some introduction about our global health department and also health equity in China. So Jerry, could you please, yes, thank you. Next slide, please. So our department established in 2012, and this is the first department in China to train the global health graduate students in China. And our department has very wide disciplines like global health, international policy and relationship, and preventive medicine, public health, behavioral science, and others. So next slide. And we have the 12 faculties now, and like Professor Zhang, Professor Fuqiang, and Professor Lieberthal-Rogel. So these are, very senior professor in China, and Professor Lieberthal-Rogel the first head of our department. And then Professor Zhang took over from Professor Lieberthal-Rogel. And now we have 12 faculties. Today, our colleagues Yanan, Zhang, and Yinghui will join the panel discussion later. So I will give them the floor after the presentation. So next slide. And I think several of the issues our department are focused on. The first is the partnership building. So we have the very good collaboration with the Institute of Geneva. We have the Global Health Diplomacy Executive Training course, and we have the overseas research and the training centers in several countries. And we also have the China-Harvard Africa Network and the PKU Global Health Training Partnership. So these were partners we are work and to collaborate each other, and we will continue to work on with all these partners. Next slide. And the capacity building is another issue our department is working on. We have the very special program like the young generation training. We call it the Way to Geneva. And ours will send the young generation to WHA to let them explore to their, their very good environment, and to learn from their, how a young generation need to know for their, participating in the global health governance. And we also have the 2 courses to provide to their our students. One is called Introduction to the Global Health. This is for the postgraduate students, and we opened another course called Global Health Governance. So this is the 2 courses we opened in global public health, and we sent the delegates which we select from young scholars to Geneva, particularly in WHO, since 2012. So we continue to have such kind of programs, and we are continue to work on. Next slide. And the Chinese consortium of University for Global Health, which was also leading by the Tufts University, and the Peking University is the co-founder of this consortium. And then now this university, this consortium already connected with 24 leading Chinese universities. And we also have the global health network. So Peking U was also the first board secretary and the chair of the institution of the global University for Global Health. Next slide. And we are also pay much attention to the global health research. So from 2012 to 2021, we actually complete more than 70 international and domestic research projects, and we published more than 100 papers because we established on the since 2012. So this is the publication and the projects we complete from 2012 to now. Next slide. And the research on global health governance, including the regional and country study on health cooperation. And we are also looking for the global health WHO reform and the China achievement global health related MDG and SDGs. And we also look at the strategic plan for global health cooperation between China and Belt and Road countries. And there's some also the project from their, Africa. And so for the epidemic prevention and control for the Beijing Olympic Games, we also participate in some of the research to provide our advice to them. Next slide. And for the global health strategies, and PKU take the leading role to provide their evidence and the advice to National Health Commission and also to the Ministry of the Commerce of the China. And we also help National Health Commission to develop the national health security and the research strategies. So all this work was very, very close related to the global health governance. And we are also actively participate in the national global health strategy as well. So this is the major. This major work was led by the Peking PKU and our department. Next slide. And we also have the thematic global health issues like the no communicable disease, global security, health security, and aging issues, and also the environment issues as well. Next slide. So I think one of the key work our department is doing is to provide the policy consultant to the Chinese delegation for WHA, for EB of the WHO, and also for the WHO consultative expert working group. So we have many of the young senior and young teachers have been worked on this project since 2012. And each year, our colleagues will participate in WHO and also the EB to provide their advice to their national Chinese government delegations. Next slide. And for the medical insurance and the health issue in China, so China has a different scheme for their insurance. So for the employees in urban, we provide the urban employee basic medical insurance, and for the rest of the urban and rural residents, which is the bigger one, we call it the urban and rural resident basic medical insurance. And then China government also provides serious disease insurance. And together, 1.35 billion people are insured. So the coverage reaches the 95%. So besides that, China government also provided medical assistance, which covered, the 87 million population. So the health coverage is very, very high. Next slide. And if you look at to the cost spent on health, we compare the year 2009 and 2019. The health expenditure on health totally was increased 3.7 times from 2009 to 2012, 2019. But the expenditure from the government increased 3.6 times. But the personal cash expenditures only increased 2.9. So most of the government and the social health expenditure was increased much more than their personal cash expenditure. And total GDP, total health expenditure in GDP increased from 5% to 6%. And per capita health expenditures increased 3.5 times from 2009 to 2019. Next slide. And if you look at the equity trend for health resource allocation in 31 provinces from 1998 to 2016, you see their concentrated index is more fair for their based in health faculties, but not for health faculties and the health personal index. So the overall, I think that the base in health faculty is more fair and showing the more equity issue. Next slide. And the issue, I think there, if even we have the very high coverage, we have the their trend, a good trend, but there still has some problem. For example, the number of doctor nurse the ratio, some kind of still less than 1, and the health resource in China still unreasonable. The equity issue between the region is poor. So some bigger city have their very concentrated health resources, but some provinces are not. So the focus of health research investment should be shifted from to the number of research to the rational distribution between the structure and the region, and the utilization of the efficacy of the health resources. So this is some issue China needs to consider and to improve in the coming years. Next slide. So come back to the health issue and the related issue for COVID-19. I think the health equity is the issues, but the health issues. So for COVID-19 vaccine equity issue, which is not the fair, and high income countries have very higher vaccination coverage, but their after region are not. So this is the issue we have to consider about the global health equity, and how can we improve the health equity issue globally. Next slide. And I think that I can skip several slides. Next slide. Next slide. So this is some, the issue China learned from their past. How can we respond to the emergency very quickly? How can we learn from the past to do the better, the case detection and the case management? And also in China, from the beginning of the outbreak, China used a very good, strategy to better distribute the mask, because this is the issues. How can make their production was equally distributed to the people most need. Next slide. And we also have very good strategy to arranging their research, the vaccine research and development, and we have seen that this is very successful. Next slide. And today, I think the United States and China have very good coverage, and also both countries have started the booster administration in the past several months. Next slide. Next slide. Yeah, but the issue, is in the Arab country, middle income country have very high coverage, and there are some countries like Israel, some countries already started the first dose of the vaccination. So these are the issues show that the global health equity, particularly for the vaccine equity, is still an issue, and we still have some problem to better distribute the vaccines. And there's global health governance and global health equity is still issues for most countries. And I would like to discuss this issue with our class today. And I think I can stop here. And thank you for listening. Over.
Really helpful, Professor Sui. Thank you. To seed our discussion, do you want to start off by just introducing each of your faculty? And I think they each had a few comments to make, and then I'll do the same with mine, and we can get some more discussion going. So back to you, Professor Sui.
Okay. And so my colleagues are here. So our colleagues, including the Yin Hui, she is take care about the health promotion and also the global health governance. And our next colleague is Yanan. She is an assistant professor and also take care about aging and population health issues. And another is our assistant professor, Zhang. He is take care about the climate change and environmental health issues. So, for my colleagues will also join the panel discussion. And I don't know if any of you would make some remarks or have some something to say here. Zhenyu, do you have something to add?
No, but I can introduce myself in my turns later.
Okay. So if not, we can, Professor, we can maybe give some other brief introductions during the panel discussion. Over.
Okay, and just to clarify, did any of your faculty there at PKU have any slides or prepared comments that they wanted to make?
No.
Okay, all right, thank you.
Thank you.
Professor Hui, I see your slide up there. Were you going to offer some comments?
Can I start sharing my projects, research projects discussion? Okay, okay. Yeah, I'm very honored to have this opportunity to share and discuss about the future collaborations. And my global health equity related work has three focuses. The first is the behavioral health and health promotion, including the vaccination behavior study among the migrant left behind children. And just last month, we have finished a study in Malawi about the COVID-19 vaccine hesitation. I'm interested also in the smoking behavior among children and adolescents, and to reduce the maternal mortality rate in China, we have to do some research about the facilitate delivery behavior among the pregnant women in rural and remote China. And in the digital era, that the school-age children are spending a tremendous amount of time looking at screens. So especially after the COVID-19 pandemic, so we are doing a research project about reducing the excessive use of screen time. And after the COVID-19, we are now doing another research about the association between the mask-wearing behavior and the social phobia. And all in all, I'm very concerned about the the children and the adolescents and the pregnant women and people in the rural and the middle areas of China. So I think that those people population are very priority population for health equity. And I'm very interested in the social and the culture, especially the cultural determinants of health. And I think these are the causes of health inequity. So this is the first of my research focus. The second is the global health systems and the governance, including the global health strategy study for China and a number of regional and country studies on health policy and system. For example, between China and the ASEAN countries, health corporations, and the China and the Shanghai Cooperation organization member states, and including the analysis of engagement of nested actors in global health governance. As you may all know that last month, the WHA special session has started international process to negotiate an international instrument to strengthen the preparedness and response to the pandemic. So I have been doing research about this pandemic treaty and provide the consultation to the Chinese delegation. And my third research focus is about the global health competency and education. And as now, just as Professor Cui mentioned, that the global health education has only has less than 10 years now in China, so it's very young, and we are still exploring and designing the global health competency for Chinese students. So we have done some research about reviewing the current global public health competencies. We have 8 models, and we use like cohort analysis and generated like 3-dimensional global health competency model for Chinese talents. And I'm very interested in the multicultural competency within this model. I currently have 3 major projects. The first is the multi-component intervention to reduce the excessive screen time among the school-age children in Beijing. It is a randomized control trial. And the second project is to support and advocacy for the establishment of the national level smoke-free legislation in China, including a case study on the experiences in re-employment for low-income people working in the tobacco industry after the legislation, and the analysis of the tobacco retailer presence around the primary and middle school, and analysis of the depiction of tobacco use in children's picture books in China. And my third project is the cultural competency study, and we want to review the academic meaning, the current tools and the training modules provided currently, and we want to develop a curriculum module for the Chinese students, and we hope that this module could be more in line with the Chinese actual situation. Next slide, please. So for the future collaboration, my first interest is to learn from you about the tobacco control policy implementation study. So at different levels, in city levels or national levels, how people hold the beliefs and reactions about these legislations. And second, I'm interested in screen time monitoring and interventions in other low and middle income countries. And the third, I want to learn from your side about what outcome indicators do you use to evaluate your students' multicultural competency, and what tools and courses or training programs do you provide, and how do you assess your teaching quality with this regard? And last, I have been very interested in the impact of global health policy on health equity. I think currently we have a number of global health policies which aimed at reducing the global health inequity, including the COVAX, IHR, etc. But how to evaluate those global level health policies on the health equity dimension? So I'm very interested in that if we can future collaboration on this issue. So that's a very brief discussion about my research, and I'm very looking forward to the future collaborations. Thank you.
好，谢谢。It's really, really exciting and important work. Thank you.
Hi. Hi everyone, my name is Zhang. It's my honor to share my research idea here. So next slide, please. Okay, I have 3 research focus, and the first one is a particular matter air pollution exposure estimation and health-related studies. So we know that exposure to air pollution increase our risk of developing a range of disease. In the environmental IP study, it's important to estimate the air pollution individual exposure. So we use the deep learning neutral network that incorporate the meteorological measurements and the land use term and the satellite-based measurement and the simulation output from some chemical transport model to estimate the daily concentration of a particular matter air pollution exposure in some like unmonitored areas. So after do the exposure estimation, we are currently conduct two research. One is to estimate the association between the PM air pollution and the stroke in a national representative samples. The other one is to estimate the association between the long-term PM air pollution and periodontitis with the data set from the fourth China National Oral Health Survey data set. And the second research focus is long-term PM air pollution and the otolaryngologic disease. So we collect some data from Johns Hopkins Hospital by the electronic health report record system from 2013 to 2020. Cases were some people who have otolaryngologic disease, and the controls were patients who have some facial pains and conduct the facial CT scans. We finished a series paper on the association between the PM air pollution with the anosmia and thyroid cancers and the chronic rhinitis and also some non-allergies rhinitis. The third research focus is trying to establish the association between the climate change and the infection disease. As we all know that our planet is becoming warmer, it's crucial to know how climate change will affect human health. In the past 30 years, the climate condition have become increasingly suitable for transmission of multiple infectious disease by directly affecting the growth and the survival of the pathogens and also their vectors. In this study, we want to know how climate change will affect the incidence of the meningitis globally, and using the GBD data in the past 30 years. And also the second one is as the global warming, that the mosquitoes will run beyond their current habits and shifting the burden of disease like dengue rivers and the West Nile virus. So in the second study, we use the data set from the US National Ecological Observatories Network to catch the mosquitoes from the different states since 2014. And test the pathogens in the mosquito. We want to check the association between the pathogens present and the temperature change with the temperature change in the US. And which could be used to identify whether climate change will affect the pathogen present on mosquito and then indirectly affect the humans and the livestock. Currently, we don't have the result for these two studies. I hope that we can share these in the future. Next slide, please. So when talking about the climate change, there are some topics. One is a direct impact, such as the temperature increase will increase the frequency and the intensities of the heat wave, and aggravates the circulatories and the increased health risks caused by the disasters, such as storm, hurricanes, and also tornadoes and the floods. And there are also some indirect impacts, such as climate change will increase the concentration of air pollution. And as we mentioned, the climate change will also increase the reproduction rate and the distribution of the vector-borne disease, also affecting the food and the water-borne disease. And the climate change could also impact the vulnerables. Populations such as the elderly, the children, and the people living in the poor conditions, and some people working outside. And these are the topics these are the topics that are important topic people are doing now. So next slide, please. So future, I think, so we can some collaborations like climate change and the inequities. So people in the low and middle income countries are around 5 times more likely than people in high countries. So, and these in the past couple of years, extreme weather disaster occurs very frequently. So I think we can have some collaboration on the climate change and inequities and find some like vulnerable population to conduct some research on different outcomes. The other one is the climate change and the infectious disease. As we all know that the climate change can have the can affect the vector-borne disease, and these days the infectious disease such as the COVID is a very important topic, and both climate and the infectious disease are a very hot topic. I think in the future, so we can find some data, maybe start with some GPT data, and to check the association between the two. Yeah. So these are okay, that's all. This is all I want to share, and I'm hoping to have some collaborations in 2022. Thank you.
Yanan, are you ready to share the slides again?
Yes, I changed to use the telephone to log in.
So you may proceed.
Okay. Okay, I will continue. In these slides, I would like to introduce some hot topics which I pay close attention in my research field. Firstly, for the disability, the issues of prevention and rehabilitation of function impairment and mental disorders related disability for older adults are critical under the population aging background, and construction and perfecting of the security system for disability prevention are also a hot topic in this field, such as the design for the social security for the disability and the financing system design and human resources design, and also some assistive technology design for the disability are very important. Additionally, the disability inclusion is also a very important part, such as how to bridging the disability deviate through digital technologies, especially for the old adults with functional impairment. And in the field of life course health, researchers always focus on the consequence of the risk factors exploring critical life period and its relationship with later life health outcomes, and also the impact of cumulative disadvantages throughout the life course are very important. And thirdly, in my close attention field of health inequity, the equities contributed by protected characteristics such as the gender and ethnic inequities, and also the inequities from socio-economic factors, and also the rural urban disparities or regional development differences, and also the impact or vulnerabilities and the governance inequities are also the hot topic of this field. And in the field of life expectancy, the demographic and statistical researchers focus on the estimation and prediction techniques of life expectancies. And for researchers in public health or population health, the health life expectancy and its inequity from the modifiable risk factors are the hot issues to be resolved. And also the health life expectancy estimation technology also be used in other fields, such as the estimation for the healthy working life expectancy. Next slide, please. In this slide, I listed some potential collaboration. I think in the future, we could do some comparative work in the field of aging and health, which are significant to provide the framework for the policymaker to make global health governance system or policy. I think the students and the research fellow exchange program or workshops or joint education may be an important way to construction the connection. And also in the context of China, the National Natural Science Foundation of China provide some fundings for the international cooperating research. So I think the co-application may be a good way for the future collaboration. That's all. Thank you.
Thanks, Yanan. So I think the presentation from Peking U here, and I will hand over to our Peking site. Over.
Well, thank you, Professor Sui and colleagues. Boy, what an incredibly interesting and engaging body of work. And I know you've only scratched the surface of what's going on there at PKU. Let me turn to some of our members. Similarly, we're just going to give you a little, just a few views on the way we're thinking and some of the things we're doing. We have about 6,000 faculty here at University of Michigan, and it always takes some time to try and get the right people and the right topics linked up. But a lot of what we're doing right now is sharing concepts so that we can really try and activate on some of the things that we've heard. I'd like to first turn to Dr. Zhang Ayanian. John is part of the leadership team here at the Center for Global Health Equity. He's a professor in our School of Medicine, in our School of Public Health, and in our School of Policy, and brings really a broad breadth to what is the issues that come to the table when we're talking about Center for Global Health Equity. He's had a long career in this space, and I think he's going to give us just some overarching views on his perspectives. John, thank you for joining us.
Thank you, Joe, and it's a pleasure to join this important discussion with our colleagues from Fuqiang University and the University of Michigan. As Joe mentioned, I'm a professor here at the University of Michigan. I'm a practicing physician in internal medicine and a health policy researcher. And the focus of my work over my career has been on access to care, quality of health care, and the role of health equity and health disparities primarily within the US healthcare system, although I have a number of international collaborations around these themes with colleagues around the world. I lead the Institute for Healthcare Policy and Innovation here at the University of Michigan, which is a partner of the Center for Global Health Equity. It's an institute with nearly 700 faculty from 15 of our schools and colleges, many of whom are focusing on both US and global health policy issues and how we can improve both healthcare as well as population health. So what I'll be talking about is how we approach health equity and health disparities here in the United States. Our Centers for Disease Control defines health equity as the ability of individuals and communities to attain their full health potential without disadvantages related to their social position or their social circumstances. And the flip side of health equity is inequities, and those are measured here in the United States, much like you've described in China, in terms of differences in life expectancy, quality of life, rates of disease and disability, as well as access to care. Next slide, please. So the field of research here in the US, in the United States on health equity and health disparities dates back to the mid-1980s. That was the first time that our US federal government issued a report on health disparities focusing on minority health. We have a diverse population here in the United States, many racial and ethnic groups, as well as immigrants and US-born representatives, residents. And so from 1985 forward, over the next 20 years or so, there was a growing body of research describing the magnitude and the extent of disparities within the United States, really defining the problem and why it needed to become a priority for our federal and state governments and for our health systems here in the United States. Around the year 2000, we started shifting beyond just describing the problem to understanding the reasons why we have health disparities here in the United States, including the mediators, the social determinants of health, the differences in clinical services and healthcare, the differences in access to care, many of which relate to insurance coverage. You've described in the issue of insurance coverage in China, where you've achieved approximately 95% coverage. Here in the United States, about 90% of our residents have insurance coverage, a combination of public and private insurance. And that's an important tool that we have for addressing health disparities and promoting health equity. And then finally, over the past decade, and I expect into the next decade and beyond, we've been very focused on developing effective interventions, both policy interventions as well as community and clinical interventions to reduce the impact of health disparities and to promote greater health equity. And when we look over this time horizon from the mid-1980s, what we saw was through about the year 2015, improvements in health equity in terms of life expectancy and infant mortality and other measures, narrowing disparities. I would say in the past 5 to 10 years, we've actually seen substantial slowing of the improvement in health equity. And particularly in the past 2 years during the COVID-19 epidemic, we've seen an actual widening of differences in life expectancy by income or by racial and ethnic group, particularly with Black or Hispanic Americans having some of the most severe outcomes and reductions in life expectancy related to COVID-19. Next slide. So this is a conceptual model that colleagues and I have used to approach our research and policy interventions related to health equity and disparities. We're very focused on individual patient factors such as race, ethnicity, gender, and insurance coverage, as well as community factors. We've learned in the past decade that where people live and work can play a greater role in their health outcomes than their genetic profile or their biologic factors. And then also we're always seeking to understand the role of physicians, nurses, hospitals, and health system factors in terms of the quality of care that individuals receive and how that quality of care influences their outcomes. But we're also paying growing attention to social determinants of health, which typically influence people's health in their communities and their workplaces, factors like the quality of education and housing and employment and air and water quality, some of the environmental issues that have been discussed from the Chinese perspective. Those social determinants of health have a direct influence on health outcomes. Next slide, please. So in 2010, we had a landmark new law here in the United States called the Affordable Care Act that has really strongly influenced the path of healthcare reform over the past decade, particularly by expanding insurance coverage, but also by funding community health centers and public health programs. And so a decade ago, a colleague and I, Richard Allen Williams, published a book chapter outlining what we saw as the important principles to promote health equity, including health insurance and high quality care for all, developing a more diverse healthcare workforce to meet the needs of our diverse population in the United States, focusing on patient-centered care, putting the patient first in our healthcare systems to ensure they get what they need. And then finally, developing accurate data to monitor disparities and measurable goals and action to achieve health equity. And so that brings us to that third phase of developing effective interventions over the past 35 years in terms of how the United States has approached health equity. And I welcome further discussion with colleagues here at the University of Michigan and Peking University. Thank you.
Thank you, John. I should also mention John leads a whole Institute for Health Policy and Innovation, really the leading one in the United States, that really brings together a number of stakeholders that really focus on these issues. So thank you, John. I'd now like to introduce Anne Chiling. Anne is also a member of the faculty of our public policy school. But relevant to this discussion, she's the director of the Lieberthal-Rogel Chinese Studies Center. As I mentioned earlier, our relationships with China have been a critical success ingredient for the University of Michigan. And we are, she was going to be offering just some comments, maybe a little bit less about actual global health equity, but just the, how do we collaborate with China? Since we're looking for common space to move forward in, any of her reflections would be appreciated. Anne?
Thank you very much. So welcome to everybody who is here on this conference today. It's a real honor to be able to speak to you. Next slide, please. The Lieberthal-Rogel Center for Chinese Studies is beginning its 61st year this year. We have 60 years of history from 1961 to 2021. And what I think we do can be summed up very briefly in that we support people and projects at the University of Michigan and elsewhere that advance the study of China and Chinese society. So what I want you to learn from this is that unlike Professor Ayanian Center or Chuanwu Center, they're going to talk about later on, or the Center for Global Health Equity, our primary purpose is not to carry out specific projects. What our purpose is to support the people who are doing those projects and to do those projects themselves. Because what we want to be is a gathering space and a home for people across the university who are doing work that involves China and engages China. Next slide, please. So let me tell you briefly first about our people. We have faculty associates from over 30 University of Michigan departments and schools, and from 2 of the 3 University of Michigan campuses. And these faculty associates are, study everything from music and dance and food to health, to anthropology, to political science. It's a very wide-ranging group of faculty who connect to the topic of China and subjects related to China in multiple different ways. In addition, we have over 50 center affiliates from the University of Michigan and also from universities around the world. And these are scholars, some at UM and some elsewhere, who take an interest in our work and who use our center and our resources and our facilities as ways not only to support their own work, but to find other people to collaborate with. We support both postdoctoral and PhD student fellowships. We have our own postdoc program. We bring in 2 postdocs a year. Again, what people are doing is extremely different. So last year we had a postdoc who worked on the literature and the language of Chinese ethnic minorities and their connection to global indigenous studies. We also have a postdoc who's working on social media and the ways in which social media and the party state intersect and work through each other. So people do extraordinarily different types of topics, but again, all with some connection to China. We also support PhD students who are in other departments and schools on campus. And so those students who are interested in issues related to China can get fellowships for us and often can get supplements to their own fellowships from the center. In addition, with the International Institute, which we're a part of, and I'll say a little more about the International Institute in a minute, we have a Master's of International and Regional Studies. And so these are students who come from all over the world who are interested in studying issues of global importance with a specific international or regional focus. And so the International Institute connects a bunch of different centers like mine, centers on Africa, on the Middle East, on Eastern Europe, on Southeast Asia, and a variety of other centers, all with a specific regional focus or with an international, a cross-cutting focus. And so we have, for instance, a center that works on global Islam. So our students come in with all of these different focuses, and we in particular we sponsor those students who are interested in a Chinese specialization, in a Chinese studies specialization. And then finally, with the center, the NAM Center for Korean Studies and the Center for Japanese Studies, both at the University of Michigan, we're a university, we're a United States Department of Education East Asia National Resource Center. And so this means a couple of different things. One is that we have the ability to offer scholarships to students who want to study Chinese or to study other ethnic Chinese languages. We have the ability to do outreach to other universities who want some support for their East Asian programs. And so, for instance, we work with the University of Puerto Rico and with San Diego State University, and we have a new collaboration with Tennessee State University. And then the final thing we do is we do outreach to the community. And so we have a very active workshop series that works with high school teachers in particular to give them support for bringing East Asia related topics into their curriculum. And then we also do a lot of work with the local and national Chinese community and Chinese studies communities. Next slide, please. So I'm just going to finish my very brief introduction here by telling you about some of the things that we can help you with if you are interested in collaboration around issues of global health or on collaboration on other China-related issues. So the first thing we can do is really help you with connections. As I've said earlier, we have faculty and who are in most of the different departments at the University of Michigan. We know about different projects that are ongoing here. Projects that we don't know about, we often have ways of finding out about. And so I really want to encourage people who are interested in thinking about a Chinese dimension to your comparative work to come and talk to us. And we may be able to, sort of put you together with people who share an interest, share a topic area with you. The second thing we do is we sponsor conferences. And so, of course, multiple centers and departments and, schools and institutes at the university sponsor conferences on the academic side, and we do that too. But what I really want to point out to you today is that we also sponsor conferences outside of the university. So for instance, we have a long-term project going with the National Committee for U.S.-China Relations. And this organization brings together many politicians, political leaders, and administrative leaders around the United States who are interested in the U.S.-Chinese relationship. And our series of conferences have specifically been devoted to subnational collaboration between the US and China. So collaboration between states in the US and provinces in China, or collaborations between cities in the US and cities in China. And so we're able to bring together not only academics, but also policymakers to think about topics that, like global health equity, are of extraordinary importance outside of academia, outside the university. And finally, we're very interested in and very committed to outreach. And again, this is outreach to both the Chinese studies community nationally and in the world, and also outreach to Chinese communities, including Chinese diasporic communities around the world. And so we really think about this outreach as a way of sort of thinking about and supporting Chinese civilization, the study of Chinese civilization and Chinese society writ large, so that we're interested in China. We're also very interested in Chinese communities in Southeast Asia, Chinese communities in Europe, and of course, Chinese communities here in the United States. And so any of these ways in which our work might intersect with work that you are interested in, please reach out to me. We'd be very, very happy to learn what we can do to facilitate the fantastic work that people have been talking about today. Thank you.
Thank you, Professor Lin. Global health as a field is so dependent on a multidisciplinary approach. And then when you bring in the concept of equity, there's so many other schools and viewpoints that could really add to the discussion and impacts that we're all desiring. So I think your center is a tremendous resource for us as we go forward. I know you have to leave to teach, so I'll say thank you, and we'll look forward to building the future conversation with you. Xie. Next, we've got many faculty who are doing all kinds of projects. So I thought we might touch on just a couple. To begin, I'd like to introduce Professor Chih. He's a professor in our Department of Environmental Health Sciences within our University of Michigan School of Public Health. Wu, thank you for joining us.
Thank you, Joe, and good morning and good evening, everyone. I'm very pleased to have this opportunity to join this wonderful panel. I would like to share briefly some of my research and also perspective on the global health and health equity. Next slide, please. So research focus in my laboratory really focused on the biofilms, microbiology pathogens, microbiome, and how that impacts the water quality, and again, what's the link to the human health. So the focus really studies the microorganisms in the environment, how that impacts the health and impact the water quality. So with this global health related project, I have been doing some of the work in different countries, including China. I'll give you a few example projects we have been doing. So one of them is integrated assessment of gastric cancer and water contamination with the Helicobacter in Lima, Peru. So with this project supported by the Graham Institute here, we have been doing the water quality monitoring in Lima, Peru for over a period of like 2 years in collaboration with the Ministry of Health and the Department of Environmental Health there to look at this water contamination with Helicobacter pylori in Lima and look at the link between this contamination and the gastric cancer occurrence in the country. And with that, then we developed some policy recommendations to Ministry of Health for them to implement. And also this project, in fact, involved a lot of stakeholders with our community in the Lima, Peru. And this is one of the projects very, very interesting that involved the community, different stakeholders, and also the basic laboratory sciences to promote the health and promote the access to the safe water in a different part of the world. Also have a project in Qatar. In fact, Qatar is another example of the countries who have a lot of resources, but they use like desalinated water throughout the country without fresh water there. So they use the desalination. But also they have some water quality issues. They use like point of use devices. So what we are doing there, we try to understand how these point of use devices impact the water quality there in the different region, and also the human behavior, how they change the point of use of these devices, and how that altogether impacts the water quality, and also long-term, like the chronic disease they may have associated with the water they consume there. So that's another interesting question project we have been doing, integrate the basic sciences but also the social sciences, human behavior in determining how this water, access to the water impact the health. More recently, we are very interested in studying the monitor the SARS-CoV-2 since the pandemic on campus and also in elsewhere to look at the transmission of SARS-CoV-2 in the environment. And so with this understanding, we'll be able to develop some target control measures. So we provide the data to the health department and also to the university, and the university use our data in fact to develop the real-time policy changes in order to respond to the pandemic on campus and elsewhere. So this is just give you a few like example projects that have some a global health aspect, but also the health equity issues. In terms of next slide, please. So in terms of hot topic in the field, again, United Nations already disclaimed that the access to the water is basic for all the human rights. But still, in 2010, the idea is with the sustainability development goal, hopefully by the 2030, everyone should have access to the safe water. Okay, have the universal, equitable access to the water. Next slide, please. So if you look at this, next, please. So if you look at this, this is 2015 data. If you look at it here, both developed countries like United States, China, the coverage to the population to access to the safe water or improved water is very high. It's more than 95%, close to 100% in some regions. But you can also see that in terms of equal issues, some other regions like resources limited countries like in Africa, their access to the safe water or improved water sources is very limited. So this is really a global health equal issues. In some regions, most of they have very big coverage to the safe clean water, but in some regions, yes, associated with these resources, they have some other factors that don't really have access to the safe water for a large population. Next, please. However, even we say in the United States, for example, we have a big coverage in this almost 100% coverage to the safe drinking water. But if you zoom in to some specific regions, for example, here is just show you in some in California, we still have some disadvantaged uncooperated communities that don't really have access to the community water system. They may on the private wells or some other ways. So even in the United States, what you can see here in some region, in some population, they don't really have access to the community water we are talking about. And not to mention, even we have this access to the community, to the improved water, but there's still some water quality issues, equality issues, exemplified by, for example, recently the drinking water crisis in some regions because the aging infrastructure we have, a change of demographic situations, there's issues like come with access to safe and clean water. This situation is almost the same, probably also the case in China. If we China here, we also have a pretty large access to the safe water. But if you think about the different disparity between the urban areas, rural areas, there's almost like you can still find this about 15% to 20% of the population don't have access to the community water, to the safe water. So this is also generates health disparity issues and equality issues that are linked to the water-caused diseases. Next slide, please. So other approach in order to manage all these resources, we talk about the access to safe and clean water. In fact, we cannot just talk about drinking water. We have to take into consideration of the wastewater, urban water cycle, like drinking water, wastewater, fresh water, groundwater, and take that all into consideration using one water approach. But also in terms of the agencies that who are responsible for the water quality issues. Now we have a different agencies that respond for the water quality. In fact, we need to integrate them together to think about all this water, like resources of water, the fresh water, groundwater, drinking water, wastewater, all together. And in fact, all these things we need to consider also what's the benefits if we want to manage the water to achieve the multiple benefits, including especially the human health. So we need to put into the human health in the center for the water management and also the resources recovery. That's some of these hot topics we are doing now in the United States. In fact, the one water approach now, almost all the 6 cities and other cities, they are really trying to integrate the one water approach to manage the open water cycle in their regions. Next slide, please. So in terms of project for potential collaborations, in fact, I'm really interested in how can we have the sustainable access to safe water for different communities. So even in the developed countries, in the United States, in China, in some other part, how can we provide access to the safe water? Because we know that the safe water access is the best human rights now, but still we have a long way to go. And there's a lot of other issues linked to this. So how can we develop the sustainable access to the safe water, including technology, policy, behavior? That's the part of the interest I'm trying to pursue. And the other one, especially initiated by this pandemic, how this built environment impact our health. You think about the different regions of the world. We have the skyscrapers. For example, in China, we have so many new skyscrapers, but in some other rural areas, we have this very barely shield for the living, and how this indoor environment, including the water and air system in the building, impact the health. And this also how to address these equity issues that for people who live in these indoor environments, we have almost like 75% of our time live in the indoor environments. This health impact is not only just the adverse health impact, but also beneficial health impact with different designs. So now I'm working with some group on campus, try to have the smart design of the buildings so that we can address the water quality, water and air quality issues, and also take into consideration the environmental health in the designing. So with this, I would like to really look forward to the future collaborations with all of you. Thank you.
Thank you so much, Wu. And I can see, boy, I wish we had planned this for a whole half day, but I know we could only get 90 minutes, and we're probably going to have a much more compromised discussion period than what was envisioned. But please feel free to offer any questions. One of the discussion elements I'd maybe like to start off with is I couldn't help but think of our own Jersey Ling at our School of Public Health when Professor Liu was talking about some of her work and the interest in China on the aging population. I know we have some collaborations with China on that. But Jersey, could I just turn to you to see any reactions or excitement to things that you've heard?
Sure. Thanks. And it's my great pleasure and honor to be part of this panel. And I think I'll just focus on, Professor Ross, research related to aging and health and in China. And I think she mentioned that her interest in disability, life course health, and health in inequality and life expectancy. And I think that, in these areas, we actually have a pretty good fit in our common interest. And for example, I still recall, in 1990, I actually did with my colleagues, we undertook a survey of 3,000 elderly Chinese in Wuhan. And then we followed up 3 years later. And that time, one thing which struck me the most was in the rural areas, elderly women, about 80 to 90% of elderly women were illiterate. Okay, that was, 30 years ago. And I imagine the conditions would, improve substantially, but still, I think that is a kind of one interesting part of the inequity in terms of, in terms of educational attainment. And over the years, I actually have analyzed, inequality in terms of health and well-being among Chinese elderly people, particularly in addition to the rural and urban inequality and also gender. And I think China is also confronting increasing income and wealth inequality. So all these are the areas I think we can work together. And also I wanted to suggest that there is very high quality longitudinal data in existence, both in China and also in other Eastern Asian countries like Japan and Korea. And of course, in the United States, we have the Health and Retirement Studies, which has, which starts in 1992. So we have tremendous amount of longitudinal data, which we can also work together. And in China, we have Charles. Charles is very well known internationally. And I think that particular data set is underutilized in many respects. In addition, I think the WHO has this SAGE study, which includes 5 mid-income countries, of which China is part of that. And that in that study, in addition to the epidemiological health interviews, they have biomarkers. And so I work with people, my colleagues at Shanghai CDC and Tianjin CDC. And so these are very, very very valuable data sets. So I think we can certainly work on that. And my personal interest in recent years has focused on longitudinal data analysis of health and well-being in OH. In fact, we kind of try to start in middle age, like 45 or 50 years of age and on. And so in that regard, so that is essentially the kind of scientific work. And in terms of the policy work, I'm very much interested in long-term care, particularly long-term care financing and delivery. And also we're talking about family-based social support. For example, we're looking at, living arrangement being probably one of the key indicators of, social support for older adults. So all these, I think, there would be some very much interesting subjects for us to explore. The Chinese society is so distinct from other Western countries, but in this particular case, we also have comparable data from Japan and from Taiwan and from South Korea. So we could do some really very, very interesting comparative study. So in that regard, I think, and I still recall, in 2014, I spent 3 months at Peking University School of Public Health, and that time I offered a very short course on aging and health. And I thought, my understanding is that there was a great deal of interest that time, and certainly we can continue to do that. I think I'll just stop here and see whether my colleagues have any feedbacks.
Well, thank you, Professor Liang. Boy, with all of the good stuff, we've run out of time. I so wish we had more, but in the Chinese culture, this would be considered the first course that was brought to the table. We've all had a taste, but we want more, and that's what we will be working towards. Maybe just a quick closing comment from I know Professor Cui, you've had trouble with your video, but do you want to offer any closing comment, or should I just wrap up?
Yeah, Professor, thank you. Can you hear me now?
Yes.
So I'm sorry, I really have some problem, and so this is a very, very excited moment, and we are really learn a lot from your side. Actually, from the hot topic, hot issue you are looking for, and also the potential collaboration in the future. So I think we have many other issues.
I think you just dropped off, Professor Cui. But we clearly heard your thanks and your appreciation for the potential as we go forward. I'd like to thank our presenters, and from our colleagues both in Beijing and here at the University of Michigan. As you can see, there are lots of places where we can connect. And historically, we've had a great culture of collaboration. And I think it's never been more important for academia to be collaborating between the United States and China. So I will be working with Professor Cui and our colleagues here to figure out, well, what's next? How do we actually make things happen? Nice talk is always the starting point. How do we make things happen? Both within our respective countries, but are there some common places where we can do things in other countries? So I think there's so much potential, and I'm really excited to be working with you and designing things for this year and beyond. So with that, I'm going to wish my colleagues in Ann Arbor a good day, a good evening to you in Beijing, and we look forward to future conversations. Thank you.
Thank you. Thank you very much.
Thank you. Bye-bye.
Yeah. Bye-bye.
Thank you all. Have a good day to you. Nice meeting you. Look forward to the future collaborations.
Zaijian.